first speaker, Mei Kwong, Executive Director at the Center for Connected Health Policy. Ms. Kwong leads the organization's work on public policy issues as they impact telehealth on the state and federal level. She is also the project director for the National Telehealth Policy Resource Center. Ms. Kwong is a nationally recognized expert on telehealth policy, and in her current role, she works with the organization's national and regional partners on telehealth issues and oversees their projects, as well as providing technical assistance to state and federal lawmakers, industry members, providers, consumers, and others. She's been published in peer-reviewed journals and is a sought-after speaker at national conferences. NIHCM's also proud to have previously worked with and supported Mei and the center through our research grant program. And we're so grateful she took the time to be with us today to share an update on federal and state telehealth policies and the potential future of those policies. Mei?
Thank you, Catherine, and thank you to NIHCM for inviting me here today, and thank all of you for attending and listening in to this talk. As Catherine mentioned, my name is Mei Kwong. I'm the Executive Director at the Center for Connected Health Policy, and I'll be going over just a very high-level overview of the telehealth policy landscape in the United States, both on the federal and the state level, and also what we can anticipate as far as what may happen as far as developments going throughout the year 2024 and the future, and where policymakers may be right now in making those considerations for those future policy updates. Before we get started, a couple of things. I am going to use the term telehealth in my talk simply because that is how a lot of the policy is written right now. It references telehealth or telemedicine, more frequently telehealth. But you may hear other speakers use different terms. We're all really talking about the use of technology to provide health services. So that is basically what we are talking about, though we may not be using the same terminology, but it is the use of technology to provide health services in some way. If we can go to the next slide, please. A few disclaimers before we get started. Please note that any information that I provide today is strictly for informational and educational benefits. It is not legal advice. We always recommend at CCHP that if you are interested in a formal legal opinion, that you consult with legal counsel. And if I happen to mention a company or show a picture of a product, know that neither I nor CCHP has any type of a relationship, affiliation, or arrangement with such a company. Next slide, please. Next slide, please. A bit of background about, if we could go back, sorry, there seems to be a slight delay on my end. A bit of background about CCHP. We were established actually as a California telehealth policy organization in 2009 underneath the Public Health Institute. We became the federally designated National Telehealth Policy Resource Center in 2012 through a grant from HRSA. What that essentially means is we receive federal funding to provide technical assistance on telehealth policy, primarily to the other telehealth resource centers who are underneath the same funding stream. However, CCHP does provide that service as well to basically the general public. So we've helped everybody from the White House to congressional members to state policymakers, different federal agencies and state agencies, health systems, hospitals, health plans, different organizations. And when COVID-19 hit more frequently, we were dealing directly with consumers and patients as well, and their questions around telehealth. We also, CCHP acts as an administrator for the National Consortium of Telehealth Resource Centers, and what that is the other 14 telehealth resource centers in CCHP a few years ago realized that there was some duplication of development of resources or efforts that we were doing in providing our technical assistance or materials, and we decided to pull a portion of our federal funding together into a common pot to work more collaboratively on projects. So CCHP acts as an administrator of that work. CCHP also has and convenes a group in California called the California Telehealth Policy Coalition, and that is made up of over 170 statewide and national groups who are interested in telehealth policy in the state. Next slide, please. So to understand telehealth policy in the United States, you need to realize that there's actually two levels for it. There's what's going on with telehealth policy on the federal level and what's going on the state level. And coming out of COVID-19 with the end of the public health emergency last year, the levels, the federal level and the state levels were not actually on the same plane. So they all did things differently and they approached the end of the public health emergency differently. For example, on the states, and again, when I say states, I'm not talking about all 50 states doing the same thing. Each state was doing different things and how they addressed the end of the public health emergency or what they were going to have as their permanent telehealth policies. But overall, when May 11, 2023 hit, which was the end of the national public health emergency, by that point, a lot of states had decided what their permanent telehealth policies were going to be coming out of COVID-19. So unlike on the federal level, they were not making a lot of decisions about like, what are we going to do now once the federal public health emergency is over? A lot of states had already decided. There were a couple of states that did mirror what the federal government did and did extend some of their policies out to future dates, but for the most part, most states had already made decisions, and those decisions, a lot of them included doing expansions in Medicaid as far as the type of services that you can provide via telehealth and what they would reimburse, where the patient can be located. And more interestingly, also around allowing audio only to be a modality that they would reimburse for. Other items that they addressed in the state level were around licensure issues, as far as making certain exceptions for licensure in very specific scenarios, such as if there was already a patient-provider relationship established, or if there was services being provided within a certain amount of distance from the border of states. So they were doing these specific carve-outs on the licensure issue as well too, but not necessarily, allowing sort of more full reciprocity of licensure. Or you would seeing states joining professional compacts, licensure compacts, to make that as sort of like a way of addressing the licensure issue. That is still something that states are continuing to look at. So right now, some of the items that we have flagged that are ongoing for states appear to be the licensure and also around prescribing as well too, which is the prescribing issue is definitely mirrored on the federal level, but on the state level, prescribing of specific scenarios, such as for contact lenses or for hearing aids, or for things related to reproductive health. On the federal level, and this is probably what a lot of people may be more familiar with, on the federal level, they did delay a lot of their temporary policies and extend them out until the end of 2024. So the temporary waivers that we saw during COVID-19 on the federal level, particularly around Medicare, have been extended to the end of this year. What's also been extended is allowing telehealth to be used to prescribe controlled substances without having an in-person exam by the telehealth provider, or falling into some narrow exception that currently exists in federal law. So the question now becomes like, what's going to happen, because we are at this point 7 months out from the end of the year, what's going to happen to all of these temporary policies? And right now, as far as I can tell, the federal policymakers have not quite reached a decision on what is going to happen. There is bipartisan support for these telehealth policies, but right now what their final decision will be as far as the future of them remains a bit unclear. Next slide. So there have been a lot of hearings over the past couple of months in Congress, also different agencies or different panels have also discussed the future of telehealth as well too. What we've been able to tell is these are some of the sort of major concerns that have been raised in a lot of those hearings, and those are concerns around fraud, overutilization, the efficacy of telehealth, access, will access be cut off, and parity. Should telehealth be paid the same as the in-person services? And then you'll see like the specific policy issues themselves, they usually fall underneath one or more of these categories. Like, for example, some of you may have seen recently in the news the end of the broadband funding program, the subsidy that they were giving to some people to allow them to access broadband. That funding came to an end essentially because they've used up all their funding. Again, a program that has a lot of bipartisan support, but they just haven't like quite gotten to that step of like extending the funding or adding more funding to it, even though there's a lot of support for it. So that falls underneath, you know, access, and in some ways, it falls underneath the access here, but that's like one of the areas or one of the concerns that policymakers have, that the policy that they need to decide on impacts as well too. A common sort of theme that we're seeing running through all these things, all these issues, are concerns over cost and money. Also, the importance of data, because they're asking for data to show that there isn't fraud or to show that this actually works. And also impacts on patients and disparities. Again, like running across all of these in some ways or multiple issue areas. Will patient lose access? You know, if we make a decision on parity, does that also impact like the patients in some ways? Efficacy, that's obvious. You know, does this work for patients? Does this improve health of patients? If we can go to the next slide. So some of these things I think have sort of been answered with some of the work that's been done over the last couple of years and even recently as well, that do address some of the policymakers' concern. And if you listen to some of these hearings and these meetings, you do see witnesses bring these items up, these resources up as well too. For example, concerns over utilization. The Medicare Telehealth Trends Report from 2024 has shown actually utilization, at least in the Medicare program, has gone down like since the height of like the beginning of the pandemic. So we've had like sort of the most liberal telehealth policies out there, but we've seen it like actually be used less as we've gone along. And I think that was to be expected just simply because of, you know, the change in the environment. Concerns over fraud. There's actually been a couple of studies by the Office of the Inspector General saying that, you know, there hasn't been like the widespread fraud in telehealth or telehealth claims that they thought there were. There's been telemarketing fraud out there that telehealth has been associated with, but telehealth claims itself, they have not actually found a lot of fraud. And then as far as efficacy, I just pulled out like one area that's around the use of telehealth for to address opioid use disorders. There have been studies on there showing that it actually has helped, and it's like lower sort of bad outcomes for it if telehealth is used, sort of like more adherence to their medication and also lowering fatal drug overdoses. So there is evidence out there that could alleviate some of the concerns raised by policymakers. We go to the next slide. Parity is a little bit more different. So there's actually been arguments for parity and against parity. Against parity said, you know, why should we be paying the same? The overhead costs are not the same as they are in person. The service itself is different from in person, so it should be paid less, etc. Those for parity have countered that by saying like, well, you know, sometimes the overhead costs, especially if you have both an in-person practice and a telehealth practice as well, you still retain those overhead costs. And also a lot of people have also pointed out that, you know, things are different for what a urban provider may experience compared to a rural provider. So maybe an urban provider is able to distribute, depending on like how their practice is set up, able to like absorb those costs, those overhead costs, for example, and not have parity in reimbursement, whereas the same may not be for a rural provider. And also noting that perhaps having a lack of parity for the reimbursement of telehealth may actually discourage adoption for it. So providers might say like, well, why bother offering services via telehealth if you're going to pay me less? I'm just going to stick to an in-person practice. So there have been like, you know, valid arguments and reasons raised both for and against, and that's been one thing that's made policymakers struggle over like, you know, what direction they should turn on this question. Next. Data. Now, this has been the interesting thing. One thing policymakers always demand as far as like helping make their decision is like the data there. And I've shown a couple of things such as like on utilization and on like the efficacy. There is some research, there is some data out there, but they still are asking more. And the interesting thing about this, as far as like data collection and what data they're asking for, we're seeing more and more groups trying to like collect that data and provide it. And I think probably the most interesting thing that we're seeing developed here are actually Medicaid programs making a serious effort to collect telehealth data. This is a snapshot from like the California Department of Healthcare Services that oversees the California Medicaid program. They've created a data dashboard now to show what telehealth utilization is, like the demographics of like people who are using telehealth, and that's all available publicly on their website. And we're seeing more and more states do this. So we are slowly getting to some of that data that perhaps may push those policymakers to make a final decision here. Now, what are possibly the final decisions that they may make? As I said, we have, like, at least on the federal level, 7 months before, 8 or 7 months before the end of this year, where everything essentially like stops, all these waivers, all these temporary allowances here. I'm not quite sure where they may go. I think it's probably becoming more and more likely that on the federal level, we may see another extension just so they have more time to make a decision. But it will be interesting to see, like, if these questions that they bring up around, access disparities and the data, will they be satisfied with what's coming out, what's being generated now throughout the year? And I think if we go to the next slide, I think this is my last slide here. This is just some information on CCHP, our website, and a newsletter you can subscribe to. And then the next slide, I think, is just our contact information. And I just want to say thank you, and I'll hand it back over to Catherine.
Great.